because this was half my costume. The other half was just heinous, so I'm like, okay, I might as well do this. Okay, so can everybody see what I'm doing here? Okay, so which side is the tibia and which side is the fibula? First of all, here's the big toe, here's the small toe, if everybody can see that, okay? So which side is the tibia? Tibia is always going to be on the inside of your legs, okay? Fibula is always going to be the outside. So the tibia is going to be on this side, the fibula is going to be on this side. Okay, so what would this one be? It's over the tibia and it's on the front. So that would be, well, no, that's on the side. No, superior is up here. It would be the anterior. Tibialis anterior. Thank you, that was what I was looking for. Because it's over the tibia and it's anterior. Tibialis anterior. The one that's going to be beside it, you're seeing here, this one is going to be another one of those extensor digitorums. But remember, guys, this is your extensor digitorum longus. If they ask you that on an exam, what is this? Extensor digitorum. That is in your arm, okay? This is the extensor digitorum longus. All right, moving over. One on the side here. We are now over the fibula. Fibularis longus. Okay. Flip it around to the back. What is this one here? Gastrocnemius. Underneath the gastrocnemius on either side is going to be the soleus. The way I remember that is it's going to the sole of your foot. It's a lame way to remember it, but there you go. All right. So we're on the front of the leg. Who has ever stabbed themselves with an EpiPen before? All right. Just gonna. People know the name of it if you know where you got to stab yourself. You're stabbing yourself in here. What is this called? Rectus femoris. Exactly. So this is the medial side of the leg. This is the lateral side. What would this become?
Vastus.
Vastus medialis. And by contrast, the vastus lateralis. Go this way. This is the tensor fascia latae. I think that there's a lot of fascia there. The way I remember that too, again, really silly way. I'm like, oh, a latte has lots of foam and it's white. Okay, here's your latte to the side. Isn't that terrible? That's how I remember it for my exam. Whatever works. Okay, this one is going to be the bicep femoris. Very similar to the bicep in the arm, except it's over the femur. Then this one here, when you see 16 and 17, this is where you have your semitendinosus, T on top of the membranosus. The membranosus is going to be on either side of the tendinosus, okay? Then over here, we have the gracilis, or the gracilius, however you want to call it. The gracilius is going to sit over the adductor magnus. So the magnus, you can see a teeny tiny bit of it in here, and you can see it here. Beside the magnus is going to be the longus, okay? So you have your gracilis, your magnus, and your longus. Whoever I was talking to earlier, I forgot to tell you, number 12 up here, right in the little tiny muscle here, that is the pectineus. Okay, this long one that surrounds the leg, so this surrounds sartorius, okay? And then you're back to your vastus medialis and lateralis. This big guy in here is the sosus major, okay? And here, it's touching your iliac crest, so this is going to be your iliacus. There's really no great ways to remember the leg like there are the arm. Yeah, it's just gross memorization, and it's a little bit tough because, yes, it is backwards from the textbook, but not impossible. You guys do have the jump images, so that helps. Does anybody want to go through that again?